Welcome back to the Pelvic Pulse. Today's meditation is for anyone who has had a cesarean birth, whether it was planned, unexpected, urgent, peaceful, overwhelming, or something in between. Before we begin, this practice is appropriate once your incision is fully closed and cleared by your provider. If you are newly postpartum or unsure, please pause and return when your body is ready. This is not about doing more, it's about meeting yourself. Let's begin. Place one hand over your belly and one hand over your heart. No need to change anything just yet. Just feel. Notice the temperature of your hands. Notice the rise and fall beneath them. Take a slow inhale through your nose and let your belly gently expand into your lower hand. And exhale softly through your mouth. Let your shoulders drop. Let your jaw soften. Again, deep breath in, heart and belly rise together. Exhale, heart and belly soften together. This is a space for your body, for your belly, for your scar. However your birth unfolded, you are here and your body is here, and that is enough. There is no right way your belly should look or feel. There is no right timeline for healing. There is only this breath, this moment, this body that you have. If emotion is here, let it be here. If numbness is present, let that be here too. If you're feeling gratitude, welcome that. If you feel grief, welcome that too. We are not assuming anything today. We are simply allowing. Take one more slow breath with both hands resting, and let yourself feel supported by your own touch. Now gently bring both hands fully onto your belly, creating a triangle with your fingertips. Begin with the lightest touch imaginable, just presencing your hands almost like you're touching water. Starting wide around your navel and your hip bones. Take some wide circles with your hands, grazing over your skin. Going clockwise or counterclockwise, let your body choose. We are not fixing, we are not forcing, we are meeting. Let your hands spiral slowly inward, like you're tracing the shape of a seashell. And if you notice areas that feel guarded or distant, simply slow down there. Breathe into them. Your body may still be holding the memory of surgery. If memories do arise, know that touch helps rewrite those and creates safety. Inhale, soften your belly. Let it go big. And exhale, let your hands melt a little deeper. No digging, No intensity, just presence. Let your fingers drift lower now toward the space above your scar, and pause there. Take a breath. Acknowledge it and say to yourself, I'm here with you now. When you're ready, bring your fingertips to the top edge of your scar. If direct touch feels like too much today, you can stay above it. There is no rush. And if it feels okay, begin with long, slow strokes across the top of the scar, moving from one hip to the other. Imagine you're smoothing out silk. Inhaling as you glide one direction, exhaling as you glide back. You can anoint yourself with body oil or lotion to make this part easier. Now bring your fingers just below the scar and repeat the same long strokes from hip to hip. Notice any differences, texture, sensitivity, temperature. You are gathering information, not judging it. Now, if it feels available to you, place your fingers gently on your scar itself. Take a breath first. And begin to gently press one finger at a time into the tissue, noting again any of the sensations or the emotions that come alive. Moving all the way from left to right and right to left. If you feel like exploring a little deeper, gently come off of the scar and like you're trying to pick up the seam of your pants or your leggings, gently lift the scar with your thumb and your fingers on either side, lifting, rolling, release. Lift, roll, release. Lift, roll, release. This is not about force. It's about mobility. It's about reminding the fascia that it can glide. If you meet tenderness, pause and breathe there. Remind yourself that you are allowed to soften. Let your other hand rest somewhere comforting, your heart, your ribs, your thigh. Remind your nervous system you are safe. Continue picking up and rolling the tissue all the way across in all directions, slowly and patiently. Your body is incredibly wise. Scar tissue is not a failure. It is evidence of repair, of knitting back together, of survival and transformation. When you feel complete, let both hands rest gently over your entire lower belly. Take a slow, deep inhale. Feel your hands rise. And exhale fully. Notice if your belly feels warmer, softer, more present. Your body is different now, and still beautiful, still capable, still worthy of touch, pleasure, strength, and reverence. This seam across your belly is not something to hide from. It is something to know. Your healing does not have an expiration date, whether you are weeks postpartum or years beyond your birth. This care still matters. Take 3 slow breaths here, breathing into a body that has opened in its own way. Breathing into a body that continues to transform. Breathing into a body that deserves devotion. If this practice awakens something in you, curiosity, tenderness, questions, or even uncertainty, you do not have to navigate it alone. This kind of individualized scar work, pelvic floor support, core rehabilitation, and nervous system integration is something I guide women through every day in my one-on-one holistic pelvic physical therapy work. Whether you are preparing for another birth, recovering postpartum, or years into your journey, you deserve this level of care. If you're feeling the invitation, you can click the link in the show notes to book a free connection call with me, where we'll talk about your story and what support could look like. There is no right time. There is only the moment you decide you're worthy of support, and you so are. Take one final breath with your hands on your belly. Thank your body. Thank yourself. And when you're ready, open your eyes, carrying the softness with you.